go across to Dr. Prince Matthew, Regional Director, Asia for Médecins Sans Frontières. Dr. Matthew, let me ask you a slightly different question about your choice of where you've chosen to work in India. You're working in Mumbai and Govandi, but also Bihar. Any reason for choosing these locations in particular?
So, well, MSF has had a long history of humanitarian medical work in India since 1999 and in Bihar since 2007. We've responded to many emergencies there. In Bihar, we have a project on Kala Azar, on malnutrition, on advanced HIV, etc. So when the COVID crisis happened, one of the things apart from responding to reorienting our existing projects was to really add to adapt to COVID. We also looked at supporting the places that we were in. So Bihar was a particular focus area for us, especially with the return of lakhs of people back to Bihar state from large cities like Delhi and Maharashtra, and the potential to overwhelm the existing healthcare system there. We've had a long-standing collaboration with the Bihar Health Department, and that continues here as well. In Mumbai, like you mentioned, we work in M East block near the Govandi slum area, which is also a very vulnerable area with a very vulnerable population. So those choices kind of dictated our projects in both these places.
Dr. Matthew, you turned an indoor stadium in Bihar in Patna into a 100-bed facility. What are the challenges you are facing there? Chunautiyan kya hai wahan par aapke samne?
So one of the challenges, the biggest challenge for us was to start a new project in the middle of a lockdown of 1.3 billion people. And this was particularly difficult because all of the usual things that we could normally get, medical supplies, surgical equipment, transport, the availability of medical staff coming from different places of India. All of this was particularly a challenge for us to get. Remember, trains, flights, all of these were locked down. And like I said, we were also going into a state where the health system could easily be overwhelmed by the number of people coming in. So what we wanted to do was to create an additional temporary structure where without putting this load onto the existing healthcare system, we could manage to do something. And that is how we set upon this idea of converting the Patliputra Sports Complex into a full-fledged COVID hospital with all of the necessary, infection prevention control measures, changes of the ventilation system, changing of the flooring, setting up different wards, and so on. And so that's what we've done essentially now in Patna.
Dr. Matthew, what more does Médecins Sans Frontières do in India to combat COVID-19?
So, the added value that we're bringing to the Bihar state response is the provision of oxygenated beds for moderate cases of COVID. So what we've seen across India is that there is what we call an oxygen gap where the availability of oxygenated beds is quite less. And this is critical as we respond to the COVID crisis. Having enough number of oxygenated beds with high flow oxygen at 10 liters per minute available 24/7 for those subset of patients that have moderate COVID and required oxygen. So that is something that we're bringing to the forefront in Patna with about 100 oxygenated beds available to the state response. We're also looking at some of the other things. For example, mental health support is particularly key. Don't forget that apart from the physical effects of COVID, COVID also has tremendous stigma and discrimination, particularly for healthcare workers. Many of them who are away from their families, working long hours, no support mechanisms exist, etc. So something that we want to do is provide mental health support to healthcare workers and other frontline workers like Ashas, Anganwadi workers, etc. going forward. We also have a new helpline that's starting now, and that is available to healthcare workers and their families, etc.
Okay. All right. Wonderful. Thank you so much indeed, Dr. Matthew.